This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, June 17th, and I'm Zach Caruso. Our lead story this week is from Drug and Alcohol Dependence and is titled Receipt of Addiction Treatment After Non-Fatal Opioid Overdose and Risk of Subsequent Overdose, a retrospective cohort study. People who experience a non-fatal opioid overdose are at increased risk of subsequent overdose, but is also a potential moment to intervene. In this cohort study, authors used statewide data from Connecticut to assess differences in overdose outcomes in the year following a non-fatal overdose by treatment type received. Overall, 56% of patients received no treatment, while 35% received MOUD and 21% received inpatient treatment. Both methadone and buprenorphine were associated with decrease in subsequent overdose, whereas neither detox nor prolonged inpatient treatment were associated with decreased overdose. These findings further support the importance of MOUD and the need to increase access to treatment in this high-risk population. A new article in Addiction Biology is titled The Potential Use of Cannabidiol in the Treatment of Opioid Use Disorder, a Systematic Review. This systematic review identified 20 studies meeting their inclusion criteria concerning the efficacy of cannabidiol or CBD for treatment of OUD. 2 human randomized placebo-controlled trials and 1 open-label trial found CBD reduced cue-induced craving in both patients receiving MOUD and those not on MOUD. Preclinical animal studies suggest CBD reduces opioids' rewarding effects and reduces opioid withdrawal symptoms. Preclinical animal studies suggest CBD reduces opioids' rewarding effects and reduces opioid withdrawal symptoms. However, these results in animal studies are mixed, with some failing to show reduced withdrawal. In one animal study, CBD did not reduce morphine self-administration. Authors conclude that CBD has potential as a treatment for OUD, however, long-term follow-up studies are needed. Next is an article in Psychedelic Medicine titled Effects of Psilocybin on Religious and Spiritual Attitudes and Behaviors in Clergy from Various Major World Religions. Using a randomized waitlist-controlled design, this exploratory study examined the impact of psilocybin on clergy from various major religions with no prior psychedelic experience. Participants underwent 2 psilocybin sessions and were assessed over time. Results showed significant and lasting improvements in religious engagement, attitudes, leadership, mood, and behavior, with effects lasting up to 16 months. Most participants described the experience as spiritually profound and reported increased prayer, meditation, and appreciation for other faiths. While no serious adverse events occurred, nearly half found the experience psychologically challenging. The study concluded that psilocybin was safe and led to meaningful, enduring benefits, though further research is needed with more diverse samples and rigorous methods. Next is a study in the American Journal of Psychiatry titled Reduced Brain Responsiveness to Emotional Stimuli with Escitalopram but Not Psilocybin Therapy for Depression. This study compared the effects of psilocybin and SSRIs on brain activity related to emotional processing in patients with major depression. Under functional MRI, 2 groups were observed, one treated with psilocybin and placebo, and the other with escitalopram and a non-psychoactive dose of psilocybin, both receiving equal psychological support. Results showed that escitalopram reduced brain responses to emotional phases, particularly in the amygdala's reaction to fear, while psilocybin caused little to no change or a slight increase in these responses. Despite significant symptom improvement in the psilocybin group, its impact on brain responsiveness to emotional stimuli was minor. These findings suggest that unlike SSRIs, which reduce emotional responsiveness, psilocybin may alleviate depression without dulling emotional processing. Our next article is in Clinical Toxicology and is titled Occult Bromozolam Exposure in Patients Presenting with Opioid or Stimulant Overdose. Bromozolam has appeared in the illicit drug supply. In 2023, San Francisco had a surge of bromozolam-related deaths, with 44 deaths that year. In the last 6 months of 2023, an ED in Baltimore had 24 severe overdoses, with 7 with bromozolam in their blood. This paper describes a series of 7 deaths. 5 reported they had taken an opioid, 1 reported ecstasy, and 1 reported opioid plus cocaine. However, all had 3 or more substances detected. 5 had xylazine detected. All 7 survived, 4 were hospitalized, and 3 discharged from the emergency department. Authors conclude that surveillance is important to detect substances in the drug supply not known to patients. Next is a study in translational psychiatry and is titled RDS-04010, a novel atypical DAT inhibitor that inhibits cocaine taking and seeking, and itself has low abuse potential in experimental animals. Cocaine augments synaptic dopamine, or DA, levels by inhibiting the dopamine transporter, or DAT, that causes DA reuptake. Modafinil, used to treat narcolepsy, also inhibits the DAT but does not produce cocaine-like effects. Cocaine is described as a typical DAT inhibitor, while modafinil is an atypical DAT inhibitor. Clinical studies have produced mixed results for modafinil as a treatment for cocaine use disorder. This study tested the effect of 2 modafinil analogs on cocaine self-administration in rats. RDS 03094 acted like a typical DAT inhibitor and produced cocaine-like self-administration in rats. RDS 04010 acted like an atypical DAT inhibitor and did not produce self-administration in rats. Pretreatment with RDS 04010 inhibited cocaine self-administration in rats and shows promise as a treatment for CUD. Our next article is in the Journal of Addiction Medicine and is titled Post-Void Residuals, Medications for Opioid Use Disorder, Patient Outcomes, and How Not to Get Fooled by Urine Toxicology Results. In this commentary, authors suggest the need for new outcomes evaluating OUD treatment. Urine toxicology has been used as evidence for abstinence, but the authors provide scenarios in which the toxicology can give a false picture of what is happening with patients and their use. The authors note urine toxicologies as a clinical tool, but contend we need to move beyond them to evaluate OUD treatment. Authors propose use of measures of physical, emotional, and social well-being, including overdose and health-related complications, but also patient-reported outcome measures, or PROMs. The authors reason that PROMs that assess substance use, mental health, and quality of life is more patient-centered and tailor treatment to meet patient needs. Our final article is in the Lancet Gastroenterology and Hepatology and is titled GLP-1 Receptor Agonists in Alcohol Use Disorder and Alcohol-Associated Liver Disease. GLP-1RA have known potential benefits for diabetes and weight loss, but there's also early evidence for potential benefits in AUD and metabolic liver disease. In this commentary, authors discuss some of the preclinical evidence and early clinical trials of potential impact of GLP-1RA in decreasing alcohol consumption, cravings, and incidence of AUD. In addition, the authors discuss their beneficial impact on metabolic dysfunction-associated steatotic liver disease and metabolic dysfunction-associated steatohepatitis. As alcohol is the leading cause of liver disease, cirrhosis, and indication for liver transplant, the authors note the potential role for GLP-1RA in addressing the alcohol-associated liver disease and support clinical trials in patients with ALD and AUD. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.